Today we are going to be discussing Candida albicans. Candida albicans is regularly known as an opportunistic pathogen that is a natural part of many people's microflora. It is in fact a yeast. It is encapsulated and diploid. It's polymorphic, which we'll find out later in the term, means both it has the traditional budding yeast growth characteristics as well as the more mold-like or hyphae branching mold-like characteristics. Whether it takes the budding or the pseudo-hyphal form depends on temperature, pH, and nutrients. Generally, if human serum, which is plasma, or nutrients coming from an animal are present, it's going to take on the more parasitic pseudo-hyphal form. The yeast forms with blastoconidia budding and is most common, and the pseudo-hyphae forms lack the proper structural forms such as parallel walls and septation, which just means segmentation, of true hyphae, which sprout-like and can develop thick chlamydiospores. Now, this has nothing to do with chlamydia. It's just letting you know the traditional shape. Asexual reproduction occurs by budding. Colonies appear within 48 to 72 hours, and it requires a special growth media, which is like a potato sugar agar. Candida albicans is a commensal pathogen, member of the gastrointestinal tract, oropharyngeal, and female genital flora. However, it is opportunistic. It can cause disease in the immunodeficient. So these are things like HIV positive, cancer patients, people that have had a solid organ transplant, or something similar. Diabetics often get yeast infections, mainly because they have uncontrolled blood sugars, and those uncontrolled blood sugars are opportunistic ways that the yeast can grab hold and cause aggressive infection. Prior antibiotic consumption is another area that is huge, and that is only because you've wiped out the bacteria that were competing for space with the yeast, and this allows the yeast to take over. When in class, when we were talking about triclosan, the disinfectant that is present in most over-the-counter soaps, people who use triclosan too often get high levels of yeast infection because they're eradicating their microflora and allowing the yeast to take over. And the yeast is completely unaffected by the triclosan disinfectant at the concentration that it's used in those soaps. Epidemiology. Candida albicans of worldwide prevalence has been isolated in soil, animals, inanimate objects, and foods. It's basically everywhere. Risk factors associated with development of invasive candidiasis include antibiotic therapy, administration of steroids, immunosuppressants, or chemotherapy. Host range, generally it's humans, but it can live on anything. Mode of transportation, most infections are from the patient's own microflora rather than from cross-infection. Rare nosocomial infection has been identified. Again, Candida albicans is part of normal flora. It's in the gastrointestinal tract, vagina, oropharynx of humans. It's basically everywhere. And the only reason that it would become a pathogen is that you've become compromised in some fashion. Sometimes oral thrush or candidiasis is common, and you'll get a white viscous coating on the tongue that smells roughly bread or yeast-like. This can be something like oral inhaled steroids for asthma, or it can be indicative of a larger immunocompetent issue.